Disclaimer: the views expressed and/or activities in this video are based on personal knowledge, understanding, and experience of the creator of this video. Viewers and readers are requested to use their own discretion and expert advice before consuming this information for any purposes. If you have any existing or pre-existing medical or physical condition preventing from any physical activities or causing any discomfort, please consult your medical provider or doctor before starting any physical activities or exercises.
Hi, welcome back to another interesting session of Knowledge Byte on my channel, and thank you so much if you have already subscribed to it. If you have not, please do subscribe to my channel and watch some interesting videos related to the knowledge on fitness, as well as my well planned exercise routines which are progressively planned over the period of time. Today's topic for our Knowledge Byte is interesting. We are going to discuss or trying to find out the answer to the question, should people with chronic health condition be doing physical exercises, or they should be recommended to do the physical exercises or not? To find out answer to this question, first we will have to understand what these chronic situations are, what these chronic diseases and health conditions are, and then we will talk about whether the physical exercise is recommended for them, and if yes, what are the precautions to be taken before, after, and during the exercise for such individuals. Hi, my name is Shailesh. I am a fitness consultant, certified personal trainer year 2018. My mission to spread awareness about health and fitness gained through my own journey, my experience and my learning through this process. What is my promise? Only authentic information, no fake promises and no fake information, everything realistic. What do I offer? Whenever I publish my videos, I publish two videos. One, Knowledge Byte, which you are watching now. Another one is an actual well-planned exercise routine covering all aspects of fitness. So please do not forget to follow my exercise routines also. So let's get back to our today's topic. Today's topic is, should the people or individuals with chronic conditions or chronic diseases be recommended to do physical exercises, or should they be doing it? So what is chronic disease or chronic health condition? By definition, it is a health condition which lasts for 1 year or longer, and it needs a medical attention or medication during that time to keep it in control. What are the commonly known chronic conditions or health conditions we know? We know about obesity. Obesity is related to our weight. When it increases beyond its normal limits, the last level of it is called as obese. Now we will talk about that more. Another chronic disease or condition what we know about is diabetes. Now there are two types of diabetes. Type 1 diabetes, where our body's ability to generate insulin or produce insulin, which is a chemical which controls your blood sugar, that ability is impaired. Body cannot produce insulin, so we will have to take the help of insulin injections to push that insulin in our body to control our blood sugar. There is type 2 diabetes, where our body produces enough insulin, but the cells lose the ability to absorb that and control the blood sugar in body. That is called as type 2 diabetes. Another health condition what we know as a chronic health condition is blood pressure or hypertension. What this condition is, when our blood passing through our vessels and arteries push more pressure in those walls of the vessels and arteries, that pressure is not normal. It is pushing it with high blood pressure, and ultimately the result of high blood pressure is a damage to our vessels and arteries. So in addition to that, age, in my view, is another chronic health condition. Why I am saying that? Because with the growing age or with the growing older age, your body starts degeneration of your multiple powers. You start losing balance. Your movements are not as active as it was in your younger age. You have loss of your lean muscle mass, you have loss of your bone density. So this is also a chronic situation which lasts for longer, and we have to reduce or slow down that rate of degeneration. So with all these different chronic situation, should we be doing a physical exercise, or we should have this as an excuse that I have this chronic health condition and I should not be doing the exercise? So in my view, whatever might be the chronic health condition, physical exercise and being active lifestyle is extremely important, but it should be done with a minor changes in your physical fitness routines. In addition to that, you should be having a proper medical supervision whenever you are doing any such activity, any physical activity, and you should continue your medication. Please remember that your exercise is not a medicine. Exercise can help you to slow down those chronic health conditions, but it cannot cure it. So your medication is extremely important, and please do not forget to continue with your medication as well as advice from your medical professional. Now let's talk about each of these conditions. Now when we talk about obesity, normally in obesity, the individual who is overweight or weight is more than your normal levels, they start losing their functional ability to do the task normally. They have, because of this weight, they are not able to continue with their natural movements. There are chances that they are not they are losing their balances. In addition to that, as the fat is more in the body, your lean muscle mass is reducing. So for these kind of individuals who are obese, the exercises recommended are such that they are intended towards the weight loss. So their diet plus their exercise, that should help them to reduce their weight. The resistance training suggested for them should increase their muscle mass and reduce the fat content in fat composition in their body. Similarly, for diabetes patient, now diabetes patient, as I mentioned, type 1 diabetes, it has a problem of blood sugar control. And if you remember my earlier topic where I talked about the energy sources for your body for physical activities, the first and the foremost energy source is glucose. Now you can imagine, if you are doing physical exercises, that is in a way working as your insulin, because you are consuming all that additional sugar which you are not able to control through your insulin through your exercise routines. So all that glucose is getting utilized, which is helping you to reduce that level. But please remember that if you are taking external insulin and also you are doing exercise, so what it means is it is kind of doubling the effect of insulin, and in that case there are chances that your sugar levels can go further down than normal, which is another again a problem. So in such cases, in such individuals, the extreme care should be taken to ensure that their blood sugar level doesn't drop below the normal levels. So with this precaution, their blood sugar should be tested before, during and after exercise, so that it is not dropping below the normal levels. Same thing when we talk about aging. Now aging, we talked about the losing balance and degeneration of muscle mass and all that. So for these individuals also, the exercises suggested should be in such a way that these exercises are helping them to stabilization. They are helping them to gain their muscle mass and bone density. It means that they are suggested to have resistance training, but all this by considering their overall capacity of the body. they should not be overloaded, but at the same time physical exercise is must for them as well, as long as they are able to continue it. So okay, so with this discussion on the chronic health condition, let's try to summarize what we talked so far, and also try to find the answer to the question which I asked in the beginning. Should the chronic health condition individuals be recommended to do physical exercises, or should they do it, or they should use it as an excuse not to do the physical exercise? So here is the answer is the active lifestyle and physical exercise is more important in the individuals having chronic health condition. But please remember that your medication and exercise goes hand in hand. Do not consider exercise as an alternative to your medication. So do not avoid the medication, but continue with your physical exercises. Also, for starting any physical activity, please consult your medical professional before starting new activity or making any alteration to your daily routines. And lastly, for every chronic condition, your physical fitness routine has to be modified and designed only for your specific needs. So please ensure that you are letting your personal trainer know about your health conditions before they design a routine for you. I hope you like this topic today, and as I mentioned, the bottom line is physical exercise is extremely important, either you have chronic health conditions or not, because that is going to help you to slow down your condition. But equally, the medication is also important. Please take care, stay fit, stay healthy. Thank you.